So I thought this audio would just help you become more comfortable with the history. Important to know our history. We are a younger profession, essentially less than 100 years old, if you look at it. Um, if you appreciate that physical therapy is a newer profession, but techniques that are used in physical therapy go back thousands of years. So what I have contained in this lesson builder is what I want you to focus on. So I want you to use a textbook to help supplement this learning. On chapter 1, I think what I've done is made it more dynamic and a little more alive. I've taken it off of the pages in a book and have made it what I hope to be a more attractive and a more engaging way of learning our history. And the audio supplement and the this guide is to help you as well. So all this in this lesson builder is fair game on chapter 1. So you always want to start with the objectives of this lesson, which is a summary of chapter 1, and be sure you're comfortable knowing and being able to talk about these objectives with a classmate and be able to talk about these significant people in our history. I think what physical therapy has done well with historically and today is meeting the needs of the time. I think the profession right now is really stepping up and working to address pain because of the opioid crisis. The book doesn't talk about that a lot, but I'm talking about it. To help people learn to manage pain by moving. I think we are currently in a health care crisis regarding obesity and diabetes. And what we're seeing is just a very strong percentage of Americans that are obese or overweight. And the consequences are devastating. And the consequences of this epidemic are people are dying prematurely. And the lifespan of the average American is actually going down, despite what you might think. Despite all these wonderful drugs and treatment that we have available today, which we've never had before, as a culture, we are not healthy. There's exceptions. I think you look around your class and look at each other. You're healthy people. You're doing a lot of very good things. And I'm not in any way applying what I'm saying to you, but what the profession is doing today is adapting to the needs of the time, and it's really working to help people manage pain, because when people have sore joints because of the consequences of being obese or the consequences of diabetes, the joints get worn out. We are seeing a problem with even teenagers having osteoarthritis, something that we see more commonly in 60, 70, 80, and 90-year-olds because of the problem with being overweight. So our job is to educate people to move and to get people to move as a way to manage pain. So that is how we're part of the sign of the times today. We are also, as a profession, I think, addressing the crisis in terms of the epidemics that are happening in the world. As they've happened, we've went through a cycle, particularly in the 80s and 90s, where a significant number of Americans were dying from HIV/AIDS complications. So the profession was working with individuals affected by HIV/AIDS. Now that health crisis, it's still a concern, and it still is a problem, especially in terms of healthcare access, but it's a manageable health condition today, which is really great. Then I think the other area of the signs of the times that we're addressing is women's health, where thankfully, because of increased access to health care, I think, and education an increased number of female practitioners, women in particular, are seeking health care to help have more bowel bladder control, to have less pelvic pain, getting physical therapy when pregnant to help manage low back pain, and to help have a more comfortable pregnancy and being able to move with less pain. So that, I think, is how we're addressing the signs of the times today, as well as doing more pro bono work for people who just don't have health insurance, and assisting those who have limited resources. So historically, what we've done is address the signs of the times. Certainly massage goes back, we have documented thousands of years. We're talking about 5,000 years ago, 3000 BC. That really got our profession in the U.S. going was addressing the signs of the time of polio epidemic that had several waves of the late 1800s and in the early 1900s. And that really is what the crux of what started our profession, is addressing that healthcare crisis. Our profession really got a push with World War I, and that injured soldiers were getting their limbs blown off because of the use of gunpowder, explosives, and fighting at close proximal range. And there just wasn't the nurses to care for the injured soldiers, so there were programs started in the United States, in particular in Reed College in Portland, Oregon, to train healthcare workers to help people learn how to walk again and how to address wounds following amputations or loss of limbs. And this was meeting the signs of the time of World War I. This was happening in the battlefield, as well as soldiers returning to the United States. Another significant event was in the 1940s. The access to healthcare improved thanks to legislation that expanded the number of hospitals and care facilities throughout the United States. It was passed by Congress. It was a wonderful investment of the American people, and that increased the demand of PT and eventually paved the way for PTAs, because there just wasn't enough PTs to meet the needs of citizens in this country, as well as other places throughout the world. The fact that we're now replacing joints has increased the need for physical therapy. And I think what we're seeing now, and this isn't in here, but I want to see it talked about, and we will talk about it, is just increased need of physical therapy for cardiac patients. People are having cardiac surgeries well into their 80s now, and even in some cases into early 90s. It's non-invasive. They're using a catheter going up through the groin, and so individuals after having these surgeries need to get moving again. The side effects are less. There's less complications. There's less premature mortality from heart disease because of these surgeries, and drugs certainly too. And so physical therapy is being seen as a real catalyst to safely get people moving again and to restore quality of life because of these wonderful non-invasive surgeries that we're seeing happen, especially, I would say, in the last 5 to 10 years. We have the therapy cap that was repealed. There was a limit on physical therapy services, particularly in the outpatient setting, so that cap on how much money could be spent in physical therapy or in rehab has been thrown out. But CMS, which is the agency, is a national agency. It's a tax-funded agency that manages Medicare dollars, has now thrown around the idea that they are going to reimburse the services of PTAs and occupational therapy assistants less than PTs or OTs, about a 10% less. So we're really fighting that aggressively within the American Physical Therapy Association. So we always have to be vigilant. So I did post some other questions here about our history that I want you to go through, and I look forward to your feedback. Thank you.